Now, when you hear the word antidote, nursing students typically think, oh no, this is a memorization question. But that's not really how the NCLEX tests antidote questions. The NCLEX tests whether you can recognize a medication emergency and respond before the patient starts to deteriorate even further. So today I'm going to reframe antidotes and reversal agents the exact way the NCLEX expects you to think. This is not drug trivia, but as time sensitive safety actions. So let's begin. Now, an antidote or reversal agent is a medication used to counteract the dangerous effects of another drug. But on the NCLEX, antidotes are almost never asked as what is the antidote of this medication? So, like, what is the antidote of an opioid? They never ask it like that. Instead, antidotes appear when a patient is worsening, a dangerous adverse effect is occurring, so the nurse must act quickly. So, the NCLEX is not testing your memory, it's testing your recognition, your urgency, and judgment. Now, before you can even think about an antidote, the NCLEX expects you to answer three questions. What medication did the patient receive? What dangerous effect is happening right now? What action will stop or reverse the effect? Now, if you skip step two, what's the dangerous effect that's happening now, and you guess, you know, then you'll have a problem. But if you can recognize what is the dangerous effect that's happening right now, the antidote should become obvious. You should be able to figure it out. So this is why antidote questions feel hard until you kind of slow down and follow the pattern. So, antidote questions are time sensitive questions. They're almost always involved in airway compromise, respiratory depression, severe hypotension, hypoglycemia, bleeding, or a decreased level of consciousness. Because the NCLEX is really asking you, does the nurse understand urgency? Okay. If time matters, safety matters. And that's way more than perfection. Okay, because that's what the NCLEX is looking for. They're looking to see if you're a safe, competent nurse. Now, there are high yield antidotes that you must know. And you'll notice in the series, I'm going to be talking about the same class of medication because that is what you're going to typically see in the hospital. Okay. So, um, so these medications are high yield NCLEX medications, okay? And opioids is always the first. So if you have a person that has an opioid overdose or an accumulation, then the antidote is going to be naloxone or Narcan because the patient is at risk of going into respiratory depression. And you'll see that by the respiratory rate kind of trending down. We said, respiratory rates under 12. You have to definitely watch out for those. Increasing sedation on your patient and unresponsiveness. So what do? You're going to see if there's an order or go run and scream for one, but you're going to administer naloxone. Because the NCLEX, the trap on the NCLEX is that students continue to assess instead of act. And so they want you to think airway breathing comes first, reverse the effect, and then reassess your patient. If a patient has taken too many benzodiazepines, the antidote is Flumazenil. Now, what will happen with a benzo is that the patient will have excessive sedation and they'll exhibit decreased level of consciousness and respiratory depression. So what do? You call for an order. There should be an order on the chart for Flumazenil. But you have to really be careful with that medication because if a person has this respiratory, depression and sedation off of benzos and they keep using this medication can cause a seizure risk in chronic users of it. So you're going to have to really remember that. Hypoglycemia, a big one. Person has hypoglycemia, typically it's because they've taken too much insulin or they didn't eat, and someone administered insulin, or they've taken too many oral hypoglycemics. The antidote would be glucose or glucagon. One thing that I want to say, patients typically get too much insulin because nurses fail to assess their patient and assess their surroundings. I remember on the clinical unit, we had a patient, and the patient really wasn't eating a lot. And a nurse went in, and the family member was at the bedside. And the nurse said, "Okay, well, Mr. Jones, I'm saying Mr. Jones, but Mr. Jones, this is your food, and I'm going to give you your insulin." Well, what happened was after the insulin, patient's blood sugar became low. They were showing signs of diaphoresis, tremors, confusion, tachycardia. So when a person is conscious, you're going to give oral glucose. But if a person is unconscious, you're going to give IV dextrose or IM glucagon, because the NCLEX wants you to treat early and don't wait for a collapse. Now, to go back to my what I was saying, my little story, was that the nurse assumed that the family member was going to make the patient eat. But if a family member is not feeling good, they may say they don't want to eat, but the nurse had given the insulin. And so we had hypoglycemia. So you really, really, really have to be careful and assess your environment and your patient very well when you're working in the hospital. Next medicine, heparin. Now I talked about, heparin, and we talked about a PTT, and the two T's make an H, so you know that when you're drawing lab work, you'll be getting a PTT for those who are on heparin. But if they have um, an excessive amount of heparin causing excessive anticoagulation, the antidote is protamine sulfate. The dangerous effect, of course, is bleeding. Patient will show signs of bruising, bleeding gums, hematuria, and so you get an order to administer some protamine sulfate. Warfarin. Warfarin is big, especially if someone's had a PE or a DVT. Um, the risk with this would be they'll notice an elevated INR, and there'll be an increased bleeding risk. I apologize. So the antidote would be vitamin K, because what's the dangerous effect? The person's going to have internal or external bleeding. And so you're going to be looking for an order to administer vitamin K. Now, the biggest trap on the NCLEX is that students mix up in heparin or with a warfarin antidote. So remember, warfarin antidote is vitamin K, heparin antidote is protamine sulfate. And the last one is acetaminophen overdose. Okay, person has taken too many. Could be by mistake because they were in pain, could be because they were trying to, there was an overdose for whatever reason. And so the dangerous effect is acetaminophen will cause liver toxicity. And so typically you'll see this in the ER, and the doctors or the provider will order an acetylcysteine, and they call it NAC. And the biggest thing with this is when you get the history of your patient and you start to realize they've taken too much, acetaminophen. They've taken too much acetaminophen. The NCLEX wants you to realize I need to intervene early so I can prevent damage to the liver. Okay. So the problem, what happens with students and where they kind of lose points and get mixed up, is that before giving an antidote, you as the nurse may need to stop the offending medication. You need to support their airway or circulation. You need to check their vital signs. You need to call for help, because the NCLEX really wants to see if you have that nursing judgment. Not the fact that, oh, I can remember a medication and remember the antidote. It's what do you do when you find that a medication is causing a patient's status to change, and that is what the NCLEX really wants to assess. So let's just do some mini scenarios. Like I said, it's the same drugs that you're going to see on the unit. And that's why I keep talking about them over and over again. So scenario number one, patients receiving morphine, respiratory rate of 8, and is unresponsive. So the problem is going to be respiratory depression. That's what you're going to be concerned about. And you're going to administer naloxone. Number two, a patient is on insulin. They're diaphoretic. They are confused. So you're concerned about hypoglycemia, and you're going to look for an order for to administer some glucose. and heparin, patients on heparin, and they're having this uncontrolled bleeding. So, of course, the problem is excessive anticoagulation, and you are going to prepare to give some protamine sulfate. You know, a lot of the time students really have problems because, you know, they tend to panic when they see this question on the NCLEX. They overthink. We see a lot of the times students overthink. They may focus on the labs instead of focusing on the patient, because we say, okay, you have to look for supporting, you know, a patient's airway if they're, you know, having respiratory depression, things like that. You know, they focus on just the labs, and then they forget that this is important. I need to hurry up and act on it, because the NCLEX rewards you to be a safe, calm, competent nurse. You know, they want you to be decisive. They want you to be safety focused in your nursing actions. That is what the NCLEX is looking for, and that is what they're testing for. You know, antidotes are safe actions, but it's important for us to recognize danger early. Okay. And so, you know, I want you to realize that antidotes are not about memorization, they are about recognizing danger and acting fast. So please download the Pharmacology Safety Mini Workbook at NurseEdScholar.com to practice antidote scenarios with clear rationales. Please go in. I'm putting it together, so please go, and it will be on the website soon. Please subscribe, like the video. I'm really trying hard to give you information that you need for you to be successful in school and on the NCLEX. And my next lesson, lesson 6, is going to be medication and lab red flags. So know when to hold medications, okay? Because all I'm trying to do is to help you study smarter and to begin to start to test like a pro. So thank you very much for watching Nurse Ed Scholar. Until next time, happy studying.